Artificial intelligence is transforming healthcare across the world, from rapid diagnostics to personalized treatment plans. But equitable access and ethical standards remain critical challenges. That's partly why lawmakers are gathering at the Asia-Pacific Parliamentarian Forum in Phnom Penh. They're drafting the Phnom Penh Declaration, reportedly in a bid to ensure the safe use of AI and to deliver accessible and accountable healthcare. Dr. Hiromasa Okayasu is director at the Division of Data Strategy and Innovation from the WHO Regional Office for the Western Pacific, and he joins us from the Asia-Pacific Parliamentarian Forum in Phnom Penh. Dr. Okayasu, thank you for joining us. Now, AI has become a major theme at this year's forum. For an ordinary patient, how could AI actually change the healthcare they receive over the next few years?
Yes, so I welcome that this parliamentary forum this year takes AI as a major topic. And then in Asia Pacific, many countries and then beyond, AI is already supporting the medical care. So that help doctors to scribe the medical history and help the diagnosis and help the clinical decisions everywhere. So this is a very significant opportunity to address the healthcare challenges of nowadays. And at the same time, that if we don't have a right oversight and an infrastructure, there is a risk of a bias and then misuse. Therefore, the parliamentarians have a significant role to play to guide the responsible AI adaptation.
Now, as you mentioned, AI is already used to help doctors make diagnoses, track disease outbreaks, and handle routine admin work. Where do you think AI can make the biggest difference to public health care?
Yes, so AI can significantly help address the health challenges in many ways, as you suggested. This can reduce the doctors' and nurses' burden on operational and coordination tasks, because many research shows that up to the 50% of their time is spent on non-clinical care practices. If AI can streamline all this reporting, scribing, and then coordination burden, then doctor and nurses can spend more time with the patients. That's the other way. The other one is a triage. So many parts of the Western Pacific region, unfortunately, don't have a good medical care access. But AI can introduce, for instance, a triage. So that if the triage is available in the remote villages, and then they decided that the baby doesn't have to come all the way to the provincial hospital emergency room now, then I think that can save a significant time for patient as well as a significant time for the doctors. And then lastly, the AI can assist the diagnosis of imaging and then diagnosis of the patient and then give relevant references as needed. So this will improve also the care of the quality as well.
Now, we know that AI is only as good as the information that it is trained on. Given that the Asia-Pacific is a diverse region, how do we prevent AI systems from getting things wrong or working better for some populations than others?
Yes. So as you pointed out, it is important that the AI is as good as the data that used to train. Therefore, I think when one country adopts the model from other countries, the local validation is important. And at the same time that the medical practice has a lot of commonalities. As you know, WHO has a guideline, which in general applies to the older population with some exception. So we shouldn't take this too seriously, and at the same time that appropriate local governance, the validation, and then make sure we have an appropriate rule of usage is very important.
Now, you mentioned earlier that AI could help people in remote areas, but are you worried that AI could actually widen health inequality, assuming richer countries and wealthier people benefit from AI first, while others are left behind?
Yes, I think that's a very important point. And then this should be the focus of this parliamentarian forum discussion today and then tomorrow and day after as well. Because currently, if you look at the statistics, the Asia-Pacific public trust and expectation for AI is very high, much more than the global average. And at the same time, adaptation is primarily in the high-income countries' healthcare setting. So if we don't do anything, then this will further expand the gap. And at the same time, that if we do over-regulation, then I think this can further expand the gap. And at the same time, if we don't have appropriate regulations and then oversight, then there is all sorts of the risks and then bias and then misuse as well. So the parliamentarian has a critical role to have a balance between that appropriate regulation and the risk.
Now, there are also concerns about accountability. Now, suppose if an AI system gets a diagnosis or treatment recommendation wrong, who should ultimately be responsible? Is it a tech company, the hospital, the doctor, or the government?
Okay, as it stands, I think it is very important to make sure that the human has a final decision. So these AI systems, regardless of a patient history, diagnosis, and then critical decision support, this is to support the human healthcare workers. And a human healthcare worker should take a look and then make a final decisions as well. And then we have to make it clear in our guidelines and then the governance that human has a final responsibility, and then make sure that it is understood both by healthcare workers and then patients and then companies alike.
Now, Dr. Okayasu, AI is moving faster than laws and regulations, we know that. So what rules and safeguards should governments be putting in place now? And how do they do that without holding back the tech innovation?
Indeed. So the different countries have a different infrastructure and then systems and then the capacity. Therefore, WHO advocates the risk proportionate the governance and then ecosystems. So the countries with significant resources can implement all the systems infrastructure and then adapt AI in a full scale. But other countries with the limited resources and capacity, rather than waiting for the perfect, WHO is advocating that they can start with lower risks and then high impact use cases, and then build the minimum ecosystems, meaning to clarify that what kind of use case is possible, and then what kind of data can enter in, and how to register, and then how to treat the outcome. And then, so this kind of minimum ecosystem is very important for many countries to get started and without waiting for perfect and then further delayed.
Now, just very quickly, Doctor, what kind of commitments do you hope to come out of this forum regarding the use of AI?
Yes, so we hope that the parliamentarians first recognize an opportunity, and then at the same time, the potential challenges associated with the use of AI. And then third one is we hope the politicians agree that they have a shared aspirations that to have a good oversight, budget, and then registration to encourage the responsible AI adaptation throughout the Asia Pacific, includes the remote and then resource limited settings.
Well, many thanks for those insights. Dr. Hiromasa Okayasu there, he's Director, Division of Data, Strategy and Innovation at the WHO Regional Office for the Western Pacific. Thank you for joining us.